2021, signify by saying aye.
Aye.
Any opposed? Mrs. Benjamin, congratulations and welcome.
Thank you.
Yes.
And thank you to my colleagues for thinking I can do the job and for choosing me. We will continue.
Yes, we just make the small
Switch.
adjustments here without changing seats.
Okay.
Okay, she's already in the right place. Okay, that's right.
Okay.
All right, thank you, Ms. Benjamin.
Now we're going to call for nominations for the vice chairman for the calendar year of 2021.
I would like to nominate Betty Haney as the vice chair for the year 2021-22.
Second.
Ms. Betty Haney has been nominated for vice chair of the board for calendar year 2021. All of those in favor?
Aye.
Aye.
No objections. Ms. Haney is our vice chair for the calendar year 2021. Congratulations, Mrs. Haney.
Thank you.
I'm the school board clerk. Dr. Weston, do you have a recommendation for the clerk of the board?
Yes, ma'am. I'd like to recommend that Bonnie Golson serve as clerk of the board for the calendar year 2021.
You've heard the recommendation coming from the superintendent that Ms. Bonnie Golson is recommended for the clerk of the board. All of those in favor?
Aye.
Hearing none. Ms. Bonnie Golson is the clerk of the board. The superintendent needs a designee if she's going to be absent to attend meetings in her place. Dr. Weston, do you have a recommendation?
Yes, I'd like to recommend Dr. Royal Gurley.
Madam Chair, I make a motion that we recommend Dr. Gore as the.
And I second it.
And Dr. Gurley is nominated in his absence, but I'm sure he was asked.
Yes.
So I know all of those in favor of Dr. Gurley being the designee. Let it be known by the sign aye. So Dr. Gurley is our designee when Dr. Weston cannot attend. Dr. Weston, do you have any recommendation of designees to sign documents in your absence for the calendar year 2021?
I'd like to also recommend Dr. Royal Gurley.
Madam Chair, I motion that we have Dr. Gurley as designee to sign all documents in the absence of the superintendent.
Second.
We need two?
Two designees.
Okay, I didn't see but one, okay. So is there another person, Dr. Weston, that you would recommend to be nominated to sign documents in your absence for the calendar year 2021?
Ms. Golson, can you remind me who we've used previously? Okay, so thank you, Ms. Golson. Dr. Royal Gurley and Ms. Bonnie Golson. Thank you.
Madam Chair, I make a motion that the two nominees be Royal Gurley and Bonnie Golson.
Second.
You've heard the recommendation and the motion. All of those in favor?
Aye.
The motion is carried. We have a code of conduct. I guess I'm reading this right, Ms. Golson. In August 2005, recognizing that persons who hold public office have been given a public trust and that the stewardship of such office demands the highest levels of ethical and moral conduct, any person serving on the Dinwiddie County School Board should adhere to the following code of ethics. And it reads, as a member of my local school board, I will strive to be an advocate for students and to improve public education, and to that end, I will have integrity in all matters and support the full development of all children and the welfare of the community, commonwealth, and nation. I will attend scheduled board meetings. I will come to board meetings informed concerning the issues under consideration. I will make policy decisions based on the available facts and appropriate public input. I will delegate authority for the administration of the schools to the superintendent and establish a process for accountability of administrators. I will encourage individual board member expression of opinion and establish an open two-way communication process with all segments of the community. I will communicate in accordance with board policies, public reaction, and opinion regarding board policies and school programs to the full board and superintendent. I will bring about desired changes through legal and ethical procedures, upholding and enforcing all laws, state regulations, and court orders pertaining to schools. I will refrain from using the board position for personal or partisan gain and avoid any conflict of interest or the appearance of impropriety. I will respect the confidentiality of privileged information and make no individual decisions or commitments that might compromise the board or administration. I will be informed about current educational issues through individual study and participation in appropriate programs such as those sponsored by my state and local school boards associations. I will always remember that the foremost concern of the board is to improve and enhance the teaching and learning experience for all students in the public schools of Virginia. Therefore, I will always strive to demonstrate appropriate behavior, conduct as a public school board member. I have read the code of conduct, and we also have it on the back of our dates of our meetings for the year, so we will not forget it. Thank you, Ms. Golson, for doing that.
I think we need a motion. to
Do we
adopt
need a
the dates.
motion?
For the adopting of the dates.
Beg pardon?
Page 3, adopting of the dates.
Okay, yeah.
Mm-hmm. Madam Chair, I move that we accept the proposed dates and times and recommended by the administration.
I second it.
It has been moved and seconded that we will accept the dates as recommended by administration. All of those in favor?
Aye.
All right, and the dates have been accepted. Code RVA. Ms. Haney currently serves on the Code RVA Regional High School Board. We need to appoint or reappoint Ms. Haney to serve on the Code RVA Board.
Madam Chair, I move that we reappoint Ms. Haney to continue to serve on the Code RVA Board.
Second.
It has been moved and seconded that Ms. Haney will continue to serve on the Code RVA Board. All of those in favor?
Aye.
Aye.
It has been moved and properly seconded that Ms. Haney will continue to serve on the Code RVA Regional High School Board. The next board is the Appomattox Regional Governor's School for the Arts and Technology Board. You want to take it?
Okay, and Madam Chair, I move that Mary Benjamin, yourself, will continue to serve on the Regional Governor's School Board.
Second.
Okay, it's been nominated that I will continue to serve for the Appomattox Regional Governor's School for Arts and Technology Board. All of those in favor?
Aye.
Hearing none, I will continue to serve and I enjoy serving on that board. The board decided to make the following advisory committee council appointments and its annual organization meeting. We have several lists for approval. Board, what is your pleasure?
Madam Chair, I move that that we approve the advisory board as presented.
Second.
It has been moved and second that we approve of the advisory boards as we have them, the career and educational. Is that it?
Yep.
Career and education, technical education advisory board, special ed, and that's it. So we have Ms. Haney
Mm-hmm.
and what other one?
I think that's it.
Ms. Haney will serve on the Career and Technical Education Board. And is that it? Were there two of them?
Yeah, we have other boards, but they don't have to be approved. I make a motion that we approve the special education board and the career and tech board, unless we've already done that.
Let's see.
You've already done that.
All those, you already did that, so Ms. Haney will serve. Thank you, Mrs. Haney, for taking that
Thank
on
you.
again. Is that it? This end?
Yes, ma'am. that's it.
Okay, this ends our reorganization. Thank you for coming, and we're gonna move on with the business, other business of today. We're gonna do our recognitions now.
Yes, Ms. Benjamin, if you remember last month, I talked to you all about, or I guess I informally introduced to you our student representatives for the school board, so that our folks at home could hear their names and hear a little bit about them. This is the first year that we will be implementing having student representatives on our board. I'm very excited about this. I'm excited about the two ladies that will be representing our students of Dinwiddie County Public Schools. I just want to remind you all a little bit about these individuals. We're going to do a lot of smart work, and I really can't wait to work alongside them. I'd like to start by introducing to you, we have Miss Claire Colbert, and she's with us this evening, and I will tell you, these are two of the smartest people that I know. So I'm going to learn a lot. I'm going to get so smart being able to work with them. So Claire is, as I'm looking at their courses Claire's an 11th grader, and I will tell you, as I'm looking at her list of courses, there's a lot of there's a lot of advanced placement courses, dual enrollment courses, a lot of courses I don't think I could take if I had to do it at this point, trigonometry and the like, and a lot of dual enrollment, as I said, and advanced classes, and a lot of very smart work going on. And as you can see, she has got mom and dad here with her, and I know you recognize both of them, the educators in our school system. She is a part of our 100 Milers Club, part of the SEA, varsity girls tennis, on SOTA. She's on the Ruitines and the Chick-fil-A Leadership Academy, and she does all of those things and still maintains a GPA of 4.0. And that's pretty amazing, right? And she's just really a nice person too, so it's like all of that and packaged up nicely. And then we have Jamaica Weaver, and Jamaica's a 10th grader with us, and just like Claire, lots of AP classes, dual enrollment classes, advanced classes. You're taking French. I took French in high school. Maybe you can kind of help me with that. A lot of advanced courses, statistics, things like that. She's been part of our Gifted and Talented program, a member of the Junior Honor Society, the Scholastic Bowl. She's in the process of putting together her own club, so taking initiative in that area. She's been volunteering for some of our local legislators, and she's a member of the Dinwiddie Racial Reconciliation Task Force. I know she has been working with Ms. Pittman and her team. And so she brings a lot to us as well, and also maintains a GPA of 4.0. Actually, it's higher than both of them have higher GPA. So I'm really looking forward to working with them. I think they're gonna help us to put together a student advisory that can help to guide some of our work. You'll see that Ms. Golson's got your names here, so as we can get back to normal a little bit, you'll have a nice place to sit and you'll have a little name. You'll have your own microphone, you'll be able to speak. I did ask them to speak at the end during student comments. Claire is currently a hybrid student and Jamaica is a virtual student, and I think they can bring two very different perspectives to you about what's going on in our school system. So I look forward to working with them. I just want to thank also their principal, Mr. Garnes, is here with us this evening, and I do thank him for coming out to support them as well. And that ends recognitions for this evening for now.
Okay. Closed session report, approval of personnel.
Madam Chair, I would like to approve the personnel list presented to us today.
Second.
It has been moved and second that we approve the personnel list as it was presented. All of those in favor?
Aye.
Hearing no nays, the motion is carried and the personnel list is approved. Student matters.
Madam Chair, I move that we honor the parents' request and release student REL-01/21-1 from compulsory school attendance with Dinwiddie County Public Schools.
I second.
It is moved and second that the report coming from Ms. Mayor just read, approval of student matters has been second. All of those in favor?
Aye.
Motion is carried, so the student matter is approved. Consent agenda. Expenditure reports.
Madam Chair, I move that we accept the expenditure reports as presented.
Second.
It has been moved and second that we accept the expenditure reports as presented. All of those in favor?
Aye.
Hearing no nays, the expenditure report is accepted. The approval of minutes from December the 8th, 2020.
Madam Chair, I move that we approve December 8th minutes as presented. I second it.
It has been moved and second that we approve the minutes of the meeting of December 8th, 2020. All of those in favor?
Aye.
Hearing no nays, the minutes are approved. Board matters, Ms. Fleming.
Good afternoon.
Good
afternoon.
I'm here before you this evening to ask for a reappropriation to our budget. At the end of every year, the audit for the county is conducted, and I believe Dr. Weston spoke to you last month about the completion of that. And once that happens, then we have a little bit of housekeeping with our budget as far as reappropriating our ending balances in each one of our funds. So the county did this last month at their meeting, and so we need to take action as well. We had an ending balance in Fund 205, and typically, which is our school operating fund, and we asked to have this reappropriated for employee bonuses, which the Board of Supervisors approved last month. So we need to have that reappropriated in addition to the textbook fund, school nutrition, school grants, capital projects, and the CARES Act. We also have an additional $658,000 that needs to be appropriated to the CARES Act. This was our original award back in August. However, we had not appropriated this to our budget yet because due to the influx of funds from other places, we were spending that money first prior to utilizing these funds. Due to the amount of CARES Act funding across the county had to hold a public hearing on their budget again before they could act on this as well. Therefore, we had to wait until that happened. So we're asking that there's a total of $1.3 million $1,396,074 to be exact, to be appropriated to the school fund budget. I ask for your approval for this tonight. And I'll be glad to answer any questions about any of these funds. This is, it's really a housekeeping, it's a general thing we have to do every single year. And these monies are included, with our expenditure plans.
Madam Chair, I make a motion that we approve the reappropriation of funds that Ms. Fleming is asking us to do.
Second.
It has been moved and second that we approve the reappropriation fund ending year ending 2020. All of those in favor?
Aye.
It's approved.
Thank you very much.
Thank you. Emergency leave guidance, Mrs. Fran.
Good afternoon, board members and all who are assembled. My purpose here this afternoon is to present to you our recommendation for emergency leave regulations. The purpose of the emergency leave regulations is to provide guidance on how to apply leave practices for employees impacted by COVID-19 who may have exhausted their leave entitlement under the Families First Coronavirus Response Act or experience a qualifying event after December 31st, 2020. The act, which was originally announced by the Department of Labor, required employers such as the Dinwiddie County School Board to provide eligible employees paid sick leave and expanded family and medical leave for specified reasons under COVID-19. Those provisions were in effect from April 1st to December 31st of last year, thus ending the requirement of employers to maintain the leave thereafter. We were hopeful that the act would be extended into 2021. However, the Department of Labor announced that it would expire as planned. The Virginia Department of Health recommends that contagious individuals quarantine on average for 10 to 14 days. This quarantine time frame can be extended if a person is identified as an exposure or living in a household with multiple confirmed cases. We have seen some employees experience quarantines for 20 days or more. Not every employee has the leave accrued to cover an extended absence as such. Many school divisions were exploring introducing paid leave options for their employees in anticipation of the Coronavirus Response Act expiring. The emergency leave regulations that I am presenting to the board today would provide employees exposed or subject to a quarantine as a result of a confirmed case within Dinwiddie County Public Schools up to 2 weeks of leave pay at 100% for qualifying reasons 1 through 3. The emergency leave regulations would also provide 50% pay to employees subject to qualifying reasons 1 through 3 as a result of cases or exposures that occur outside of DCPS employment. And you may be wondering, what are those qualifying reasons? Those reasons are as follows. Is subject to a federal, state, or local quarantine or isolation related to COVID-19, has been advised by a healthcare provider to self-quarantine related to COVID-19, or is experiencing COVID-19 symptoms and is seeking a medical diagnosis. Expectations regarding the leave regulations are outlined in the provided draft, but for your pleasure and the pleasure of everyone hearing, I would like to highlight some of the expectations and guidance pertaining to the proposed regulations. Individuals must be employed for 30 days to be eligible for this benefit. This emergency leave is not meant to cover illnesses not related to COVID-19. And we expect employees to be responsible and good stewards of the school board policies, resources, and regulations, including paid leave time. If it is determined that an employee does not meet the requirements qualifying as an exposure or a confirmed case, is exposed as a result of not abiding by current mandates, such as not following the health mitigation plan, not wearing a face covering, attending a gathering with more than 10 people, not abiding by the school board policies while at work, or knowingly exposing themselves to a sick individual who does not reside in their household, we deserve the right to deny this benefit. The option to telework should be decided based on guidance provided in the telework regulations, GAAR, and must be approved by the employee's immediate supervisor. The determination of who is subject to a paid quarantine or telework arrangement will be determined on a case-by-case basis based on guidance from the Virginia Department of Health and in partnership with staff designated to perform contact tracing duties and the supervisor. And we also have referenced the teleworking regulations for additional guidance in the regulations. So, we recommend that the school board allow us to implement the emergency leave regulations to be effective beginning January 4th, 2021 through February 28th, 2021. We believe enacting this benefit will enable us to reduce the burden on employees and also ensure that they are not forced to choose between their salary and the public health measures needed to combat the virus. It furthermore provides a safety net to employees unable to work, including telework, should they encounter a qualifying event. So your approval of this regulation is required to allow us to pay employees this benefit as outlined. We would hope that we would have your support in this recommendation. And in closing, I would also like to thank the central office personnel who supported us in providing their advice and feedback in development of the proposed regulations. Do you have any questions or concerns?
Ms. Branch, you said it would take effect January 4th, 2021, so it's retroactive?
Yes, ma'am.
Okay.
Madam Chair, I move that we approve the emergency leave guidance program.
Second.
It has been moved and second that we accept the emergency leave regulations presented by Ms. Branch. All those in favor?
Aye.
Aye.
No nays? The emergency leave guidance is approved. Thank you, Mrs. Branch. Superintendent matters?
No, return to learn.
Oh, return to learn. I'm going on down. Thank you, Ms. Bidwell.
Well, this is, I guess, a superintendent
Yeah,
matter
it
as well,
is.
but I do need some help from the board. Thank you, Ms. Benjamin, members of the board. I am, here this evening to bring you an update as to where we are with our return to learn plan. As Mrs. Branch stated, you know, that this is a very complex situation that we found ourselves in. I'm happy to say that, you know, that up until this point, we've been very, very safe in our schools and our offices. But now, you know, now we have to enlist the help of our surrounding community to continue to keep us that way. We have, even though there have been times when our schools have been closed in the month of September, I will tell you that instruction has never stopped. Our teachers have worked hard and around the clock, 7 days a week to ensure that our students' needs were met. And that continues to be the case. I've heard from a number of families this week just the successes that are going on in our schools, the principals and the assistant principals talking about the things that are happening with their teachers and young people. And you'll get to hear this in just a little while. You'll get to hear from Claire and from Jamaica about what it looks like from their end as well. Along the way, though, I have asked the principals every time we're together, and I've asked them to remind their teachers as well on the advisor meeting when I met with them last week, you know, just to make certain that at all times we have to be ready to pivot. So I just want to talk a little bit about our current state and then talk about what my recommendation would be moving forward. As a reminder, you can see that about half of our students currently are participating in virtual learning, and about half of our students are hybrid students. We have had the luxury of being able to afford our families a choice when it comes to what's best for their families. I will tell you that over the past month, we are seeing an increasing number of our families who are actually moving from hybrid to virtual because they're watching what's happening in our community. And I have to applaud the schools because they've really tried to do their best to provide families with the options that they needed. We did have to put a hold on any movement, bringing kids back in from virtual to hybrid because we needed to kind of slow down what was going on. But we have moved several students, or many students, back to the virtual environment for temporary purposes. Many times what I've heard over, I spent the last week or so really talking to our staff and teachers and parents, and a lot of times what they have asked me is like, how are you making the decision? Because I'm watching that positivity number and I really don't understand, as I'm watching it increase, why are we even still open? And that's what I'm hearing from families and what I'm hearing from staff. And you know, in the beginning when we started this process, the only thing we had to go on was a positivity number. We really didn't have anything else. The governor made the decision to close our schools. That's what they were using as far as the data point. But since that time, we realized that that's not the only indicator that we should be watching. There are a number of indicators. And so I hope tonight helps to answer some of those questions that our folks have asked us to answer for them, and to also provide that transparency that I know that you as a board have really charged me with making certain that we're providing to our community. We are going to turn this into a dashboard of sorts that we can push out to our school community so that they will always have the most recent information available as we continue to move through this process. It's a 4-step process, the first step being how are we doing relative to the mitigation strategies that we have put in place in our health plan. The second step has to do with what's the impact of COVID-19 at the school level, because that's really where it's most important at this point. Step 3 is about what's the level of COVID-19 community transmission, what's happening in our community. And the reason that that's really important is because we're an open system. And being an open system, typically what happens on the outside finds its way inside of our schools. So we're going to take a look at that. And then the last part of that is really do we understand what our community needs? And so you have to look at all of those data points in order to make the decision about, do you stay the course and remain providing choices to families, or do you have to pause? And so I'd like to walk you through where our current status of where we are at this moment in time. So relative to step 1, you've seen this slide before. This is provided to us, it was provided to us through CDC and on our Virginia Department of Health website. We talk about this every month. The step 1 is how well are we implementing our mitigation strategies? And you know, when I take a look at all of our buildings as well as our Pathways Learning Center, I would say that we are implementing all 5 strategies consistently and correctly. We are using our mask. I have to applaud our students. I know that I've heard Mr. Schneff talk about, because he's in our buildings a lot too, seeing the young people wearing the mask correctly and consistently. We really haven't had a problem in that area. The second thing is, are we making certain that we are social distancing to the largest or the greatest extent possible? Are we following all the hand hygiene and the respiratory etiquette that's been outlined for us? Cleaning and disinfection, I will tell you that Service Solutions has done a great job, stepped up under the new supervisor. She runs a very tight ship. We get a weekly report from her with photographs and the like, and I see Claire over there shaking her head yes. So even the students are noticing some changes in our building relative to that, and I will tell you the principals have been much more pleased in that area. And then contact tracing with our local health department. And so where we are currently in that would be, we are at lowest risk of transmission. And I believe that this is why we have seen no relative cases or no related cases in our school buildings. So we're at the lowest risk when it comes to step 1. So that means really our schools are very safe places to be. Okay, so then you have to go to step 2. So what's the impact of COVID when you talk about at the school level? And there are 3 things that we have to consider when we're talking about step 2. The first thing is what's happening with the transmission in the school. And the low impact would be that we have 0 or sporadic cases with no evidence of transmission, meaning they're not related. Now, I shared in the letter on Friday that we had 51 cases. Well, since that time, we now have 60 positive cases. That's how fast, that we're seeing more and more positive, both student and staff. We currently have 30 active positive cases amongst students and staff. But none of these cases have anything to do with anybody else in the building. We have no cases where young people have given it to any adult in the building. Most of the time when a student gets the virus, the student has gotten the virus as a member of a family or something that's happening outside of school. We also have no cases of any transmission between student to student. We have had to quarantine students, to be, out of an abundance of caution, but we have had no cases where we've been able to trace back to a student giving it to another student. And I know that you're very familiar with the research that says that, kids ages 0 to 19, that's not where the greatest number of cases are happening anyway. And so, the data said right now we have 60, I said total, we have had 60 cases total and we have 30 active. So right now for us, we're at a low impact because none of ours have been related. And that goes back to those mitigation strategies that we really have been very safe. I note over here about medium and high impact. That's when we would be in a case where it would be considered an outbreak. And the way they define that is 2 cases that are related in one place. So if 2 students in one classroom happen to contract the virus at the same time, then we would consider that an outbreak. It used to be 3, but now they're saying it's 2. We have not had that be the case yet. Okay. The second criteria that we're considering is student absenteeism. Low impact would be that this would be normally about the time that we would, see we tend to watch attendance over time. Typically our attendance rate's right at 90%, even in the winter months when we see a lot of flu and colds and things, of that nature. Medium impact would be slightly above the baseline, which maybe would be like, it might be from 85 to 90%, we might have seen a little bit of a dip. We are seeing a very high impact with student absenteeism, especially as it's related to things, whether it's an exposure to COVID or it is an actual case of COVID. Right now it's hovering right about anywhere from 75 to 80%, which is very, very well below where we would normally see attendance at this time. And this is in addition, some of this absenteeism has to do with some of our virtual students that we are still working to actively engage back into instruction. So in addition to the COVID-related or the health-related issues, we are having some issues with virtual instruction as well in that area. The third criteria has to do with staff capacity, and I have defined that there at the bottom, and it really is about, what's our ability to maintain an adequate staff so that we can operate the school, so we can transport students, so we can teach students, and so we can administratively provide the business of schools. And so normally, if it's normal, there's no impact. If this is what we would normally see on a given day as far as absences and the like, we can maintain normal functions, then that would be low impact. Median impact would be strained, but right now we are currently at a critical stage. Beginning in December, we started to hover around about 60 absences a day, and that, becomes alarming, and we typically can see on any given day 40 or 50. But we started to see about 60, and what we started to see, the 60 started to be related to, some had to do with exposures, and some had to do with absences related to COVID. We have 43 people currently out on FMLA, which some of that's COVID related. 13, I think, are related to other things. So as a result of that, we have now are up around 70 absences a day. And as of like today, our unfill rate was about 35%. That's very, very high. So at the beginning of December, we started with an unfill rate of about 10%. Well, when we went to the next week, the unfill rate was about 15%. By the time we got to Christmas break or winter break, our unfill rate was hovering about 20%. Well, since we've been back, we're now in the 30s. Puts a huge, huge, huge strain on the schools because we have principals that are substituting. We're pulling paraprofessionals to substitute. We do have a very limited substitute pool right now to pull from because, quite honestly, some people don't want to come out and come into the building out of their own worries about what's going on. So we just have a lot of things going on that typically we wouldn't have happen. And I want to be clear that this is not of anybody's fault. We have put some strict mitigation strategies in place, and one being if you're sick, if your nose is running, if you're running a low-grade fever, well, typically we would all come to work, right? We're telling people now don't come to work because we don't know what we're dealing with here. And so, folks are doing exactly what we're instructing them to do, but as a result, the unintended consequences of that are that we are dealing with a critical shortage of employees to do the job that we need to do. This has been very difficult, on our schools and across our school division. I will tell you that so far, since we've returned back in September, we have quarantined 449. We have quarantined 449 individuals. We currently have 163 people that we are quarantining as a result of being exposed. So that's a huge strain, as you can imagine. All right, so that's step 2. So once you see here, we've got 2 high impact areas there and one low impact. So kudos to the schools for what they've done as far as the transmission in the school. That's something that they've been able to control. The things you can't control are the things that have to do with student absenteeism, and they can't control staff absenteeism because we are asking them to do that. We're saying stay home if you're not well, okay? The third thing has to do with what's happening in the community. And I think that this is the piece that we probably are all a little more well-versed about because this is the piece that, they put out originally, and we've when I stood in front of you, I think way back last spring and said, I was saying things like 10% positivity rate. So that has been what's caused a lot of alarm recently because that number has continued to increase significantly. So our core indicators when it has to do with the community transmission would be the number of new cases per 100,000 within the last 14 days. Now, we don't have 100,000 people in Dinwiddie County. But if you read the small fine print on the VDH's website, it tells you how they calculate and they get to that number. Right now, and they say the highest risk is anything above 200. Our number today was 806. So that puts us in not even just the highest, it would be higher than the highest area. So we're in the highest risk because in our community, our number is 806 when they did that calculation. Our positivity rate over the last 14 days, this is something that I know our staff watches really closely. I said it all along, anything above 10 is alarming, and you can see there that the the Virginia Health Department, anything above 10%, we certainly know that's alarming. Currently today, it's 19.5% in our community, the positivity rate. That's significantly above the 10%. So that also puts us in highest risk. So those are the core indicators when you're thinking about community transmission. And then there's some secondary indicators that we look at. The first one has to do with looking at the last 7 days as opposed to the 7 days before that. So what you would want to see is it to be less than 10% because that would tell you that it's starting to stabilize in the community. Well, anything above 10% would be at the highest risk. Today, ours was 80% in this area. So we are 80% higher the past 7 days than we were the 7 days previous. So that tells you that our community transmission is continuing to increase. And if you can remember, when I presented to you last month, I talked to you about it being fluctuating. It's not fluctuating anymore. It's just steady increasing. And I think a lot of that has to do with just so many people are getting it, and, families and the like, that, it's just like Dr. Hart told us before, it's not a matter of if, it's when. All right, and then another secondary indicator has to do with the percent of hospital beds that are occupied. And in our community, that's 87.9%, which puts us at moderate risk. I will tell you that, there has been, I know there's been some concern in the community about that, I know that at one point Southside was closed, or not closed, excuse me. Southside was full, so they were having to move on to the next hospital and things like that. So those are all community worries. But then you look at the percentage of hospital beds that are occupied with COVID patients, and that's 14%. So that puts us at the very lowest risk. That tells you that there are a lot of people in the hospital, but they're not in the hospital for COVID related, which is very, very encouraging, because it used to be the opposite. And then finally, the existence of local, community, and public setting outbreaks, and where we are at a yes, and where they're seeing outbreaks on churches, they're seeing outbreaks in Central State, some of the nursing homes we're seeing outbreaks, none in schools. We have not seen any here in our school setting, but there have been outbreaks. So anytime you see an outbreak in a community, it puts us at a moderate risk. So you can see in this area for our core indicators, we're at the highest level for both of them. And then for the secondary indicators, we're more at the moderate to low risk area. All right, and then the final step of our decision making says, well, okay, do you understand what your community needs, right? So the first question would be, thinking about our students and our staff and our internal school community and our external school community, are there certain populations that are impacted by a lack of in-person instruction? No, because we've been able to afford folks an opportunity to come to have a choice. And we've been able to provide anybody that wants to come to in-person instruction the opportunity to do so. Another question would be about, are there certain populations that are impacted disproportionately by COVID? And that answer is yes, and we've been provided that data by the Virginia Department of Health. And that has to do with people that are a certain age group, a certain race, a certain, so there are a lot of factors. And so we have to take that into consideration. People that have compromising conditions and the like. Have you assessed the questions and needs of the staff? Yes, we've done a couple of surveys with the staff. The principals continue to do that. So we continually take a look at what the needs of our staff are. Are there populations that we have to consider for prioritizing in-person instruction? The answer is yes. We do believe that the youngest learners need to be in school. We do believe special education students need to be in school. EL students need to be in school. So yes, we know that that's very important. Is short-term virtual learning feasible? Yes, for the short term. We are much more poised now than we were last March to do a short-term virtual learning. But as far as a long-term virtual learning, is it sustainable? Not at this time. I think until the community has what we need as far as broadband, or all of our students have access to reliable internet, that we would not be able to do a long-term virtual learning option. Do we have the facilities to allow for social distancing? That at Southside, a couple of our schools, our numbers are increasing by the day. I was looking at the enrollment just yesterday. We're right there on the 6 feet. But I will say that when we have a do contract tracing, one of the first things they ask us is tell us the distance, tell us the seating chart, and all that. But so we're maximizing every space that we possibly can in our schools right now. Do we have input from our families? Yes. And is there a forum to answer community questions and hear their concerns? Yes. And I put that link there. We're always available, and I know that you all are as well. So those are four areas that we use when we're trying to make the decision as to stay the course. Are we doing the right things? Or do we need to pause for a moment? So I just would like to summarize what I just shared with you. I want to be really, really clear. Our schools are safe. I think that we have shown that, since our young people have been back at school and our staff has been back at school, that we've shown that it is the safest place for our students and staff to be. I think that that is the case because of the work of principals and teachers and what they have done, and students, to implement those 5 key mitigation strategies. It's just amazing. And we have had no related cases within our schools. And here's the however, though. And the however is that we are seeing a dramatic increase in health-related student absenteeism. We are experiencing a critical shortage of the adequate staff needed for the safe and effective teaching, operations, transportation, and administration. Our community transmission right now is at the highest risk level possible. And then finally, we understand we have to think about the needs of our entire school community. And that means both the internal and the external school community. And with all that being said, my recommendation at this moment in time is that we move our schools do not close. Our Dinwiddie County Public Schools does not close, but that we move to virtual instruction temporarily. And the reason why I'm asking for your approval to move from January 14th to January 29th is what the Virginia Department of Health and the CDC says, that the 14-day window tends to be a good quarantining window, and that by taking that time to allow some of this illness maybe to work through for people to get on the other side of that. So allowing us these 2 weeks to do that, to do a kind of a temporary quarantining in our own homes and in our own homes and inside of our small little groups of family members. As part of that window, Monday, January 18th, schools were closed already for Martin Luther King holiday. You know that our Wednesdays are already virtual days for our students. And Friday, January 29th is a teacher work day. So it's a total of 10 days for families to, I know they're inconvenienced and I know it's a tough time, but I think that when you think of the risk versus the reward on the other side of it, that the reward is far greater, you want to minimize the risk at this moment. There'd be no interruption to Rwanti. We would continue to provide transportation to Rwanti, to our regional programs, to our athletic program, to our spelling bee, to our SOL testing, to anything else going on. We're going to continue to maintain that as long as we have the staff to assist us with that. But our principals and our teachers will follow up with our families with specifics related to the schools and or their classrooms. I'm recommending that 11 and 12-month employees report that our classroom teachers who have reliable internet in a space designated for work be allowed to quarantine at home or stay at home and work. But we would afford the opportunity for teachers to come in and work in their school spaces as well, because 11 and 12-month employees would be there. We are prepared to do meal distribution at Dinwiddie, Sutherland, and Sunnyside Elementary Schools from 10 to 1 on Thursday, January 14th, Tuesday, January 19th, and Tuesday, January 26th. And what Mr. Athey is going to do during that time is he's going to provide meals that would cover breakfast and lunch for all the days in between those days. So there would be meals covered for every single day that we would be virtually learning. And I just wanted to put a final note in here, and I shared this with you previously, that we currently are in 1B as far as the vaccines go. Right now, our Crater region is in 1A. We're very optimistic that we'll be moving to 1B very soon. Our nurses will be vaccinated this Thursday, so we're very optimistic that it's going to be just a short period of time before our employees will be a part of that process. Ms. Clark did turn in all of our information. We have been told that maybe by the end of January that we'll all be vaccinated. We'll have that available to us, the vaccination. And then by the March 1st that we would be finished with the vaccination for all of our staff members in Dinwiddie County Public Schools. And that's all the information that I have this evening. I'm happy to answer any questions or entertain any conversation or hear your comments related to my recommendation.
Now, you did say that, or I think that I was told that there would be packets available for parents to get for students if they needed them,
Thank you.
rather than being online.
That is correct. So when I met with the principals, they will be prepared to assist families that do not have the reliable internet. Because currently, you know, we have distributed over 1,000 Wi-Fis and the like, and so we have limited numbers of those available, and we would be prepared to provide paper packets for families that need it for the 10 days. Yes.
And would they have to come every day, or how would that work?
No, I think that what they're gonna try to put
It's
together
for a
is
week?
something that's a packet, yeah.
Okay.
Yeah, no, I think that might be a little, but they
Yeah.
do have a process already in place, cause they had that set up for last, spring and summer, how they picked that up.
Okay.
Mhm. Other questions or thoughts, or?
So, today is Tuesday, the children don't come on Wednesday, the
That's
teachers
correct.
do. And so they would not be attending on Thursday.
That's what I'm asking.
And do you think there's anything, now, our elementary goes 4 days face-to-face. Would there have been something at the school they needed to get or have?
Well, I met with the principals earlier this morning after, I spoke, with the board. And, just to let them know, to inform their teachers that I would be making this recommendation this evening, and to inform their teachers so they would send the students home with everything that they needed.
Just in case.
But that's a great point.
But the 12-month employees will be available.
That's absolutely
help us
right. Absolutely, yes, sir. And I just, I think, for me, I just want to make certain that I'm really clear about, we are where we are, and it's nobody's fault like where we are, that everybody's just doing the best job that they know how to do, and teachers are working very, very hard, administrators are working hard. I think they're working harder than we probably ever worked in our lives, because we just every single day is different. And I know that our families are too, and I don't think that any of us would have ever thought a year ago that we would still be in this moment in time wearing masks and talking about whether or not can we open schools, not open schools. I think we could have never thought we'd be where we are in this moment. And all we can do right now is to try to figure out what's the next right thing for our community to keep us all safe.
Any more questions? Dr. Weston? She's asking us to,
I'm asking for your support for the 2
support
weeks.
of this plan.
Madam Chair, I make a motion that we receive this, change in the return to learn update, and the recommendation that Dr. Weston is making for temporary, switch to virtual and trying to come back, at the beginning of the new semester.
Can,
It's been moved and properly second that we will support Dr. Weston in his return to learn for a short period of time, and then return on the end of the month. All of those in favor?
Aye.
Hearing no nays, we are supporting you.
Thank you. On behalf of the teachers and the staff.
And
thank you
the
so much
staff,
as well.
definitely.
Yes.
And we pray that this will
That's
accomplish
maybe
what we hope it will be, and that it will be better, and that we will continue to do those things that we are asked to do, to wear our masks, wash our hands, and try to stay as far distance as we can.
That's right. Thank you so much.
Superintendent Matt is still going, don't go anywhere.
Okay.
Budget update, Ms. Fleming?
Good afternoon again. I come before you to provide a budget update for the current school year, which is fiscal year 2021, the year we're in, and fiscal year 2022, which is we've just started planning for. The governor introduced his budget in December, which contained the caboose bill for the current year, and any changes for the upcoming year that are different from what was presented for the second year of the biennium. So I want to talk about fiscal year 2021 first. As you know, enrollment has been a major concern across the state this year. So the caboose bill has included a no-loss funding for schools. For Dinwiddie County Public Schools, that's about $1 million to help offset any enrollment loss that we may have this year. This year's budget was built on 4,250 students, and we currently have about 4,154 as of today, is what our ADM is built on. For this year, school divisions will receive funding based on our actual ADM, plus we'll be able to keep all of the enrollment loss funding. So we will be able to keep the $1 million plus if we maintain the 4,154 students, we'll receive our ADM based on that. At this time, we're taking a deeper dive into all of our funding and spending to date. And with the enrollment loss funding, we do not anticipate any revenue shortfall challenges at this time. Now, of course, the General Assembly is going to have to adopt this, but we don't anticipate that that's going to be an issue, or at least that's what we're hearing from the Department of Ed and some legislators that I listened to yesterday. So does anybody have any questions about the current year as of right now? And of course, we'll be, updating you as more information unfolds. So we are for fiscal year 2022, we are in the initial stages of that budget development. And at this time, the Department of Education is projecting that enrollment will start to pick back up next year, but probably not to the extent of pre-COVID. So based on this assumption, the governor's budget includes no loss funding for next year as well. And right now for Dinwiddie County Public Schools, that's $845,000. But this is based on DOE's enrollment projections, which right now they are encouraging us to use. The Department of Ed is basing our enrollment on 4,085 students. Now, I think that that's probably a little low. However, what they're saying that's different with this enrollment loss is it's going to be adjusted based on our actual ADM at the end of the year. So we're still working through some of that and what that may look like for us. However, if we increase our ADM, or we build our budget based on 4,150, which is about where we're sitting right now, and we receive more students than that, more students come back, that money for no enrollment loss is going to decrease as the money we receive for the students goes up, which makes sense. But other highlights of his budget include the SOQ standards for school counselors are being mandated at 325 students to 1 in all schools. Now this is a division-wide calculation, so we're doing okay with that division-wide. This was also introduced last year and kind of pulled back on, so he's putting this back in. It also restores unallotted VPI funding from the funding level at fiscal year 21. It increases that per pupil, and that is our Bright Stars program. That's our 4-year-old program. This governor is very, very pro early childhood. So this also was in the original FY 2021 budget and has now had to be removed when we went through the special session, but he's put that back in. It also includes language that our VPI programs enroll at least 10% of the students with an IEP. So it's trying to hit that population. It also provides a 2% one-time bonus payment effective September the 1st, 2021, contingent on revenue. So the last 2 days, yesterday and today, I've spent in a virtual conference with the Virginia Association of School Superintendents, as well as Dr. Weston, and the Virginia Association of School Business Officials. We have a joint conference every January. And Jim Regenbaugh presented an analysis of the state's revenue forecast and outlook. This was very positive. I mean, he felt like another revenue reforecast will be requested by the General Assembly during this session, which will be updated from what the governor actually based his budget on. And he feels real confident that this 2% bonus will actually turn into a salary increase. And so we're hopeful for that. However, at this time, it's a 2% bonus. And we'll have, more information as the General Assembly unfolds with that. So that being said, there wasn't a lot of new information with this budget. What we're seeing right now, based on the information I just gave you, is an additional $315,000 in new state revenue, which is not a lot of money to work with. especially when I start talking about the 2% bonus and the cost of that. So, required expenses that come along with what he has proposed. There are no VRS rate changes, thank goodness. This is the second year of the biennium, so everything there remains status quo. But the 2% bonus, if we were to give every employee, existing employees as of right now, a 2% bonus would cost us $605,411. We're going to receive $342,400 from the state to do this. So it's a hit of $263,011 in local cost in order to provide the 2% bonus. So as you can see, this is, a little frustrating. Yes, ma'am.
And I ask a question about that. So is the proposed 2% bonus, is that, sometimes when they give a 2% raise, there has to be an average over all staff, or is it specific 2% per person?
Well, it's a 2% bonus based on the SOQ positions.
So there are many positions that we would have to provide for.
Right, that's exactly right. And also, right now, in the past when they've done some of these things, they will say you can use something that you've done in 1 year to help offset the cost, in order to meet the requirements of receiving the state funding.
Right.
So, but right now what they're saying is, of course, we didn't do any salary increases this year, but there are some school divisions that, have talked about doing something this spring. But now they're thinking, well, if we're not going to get credit for it, in order to help offset what we are mandated to do, if we take this money, then, they're looking at not even doing that this year. So we would have to, if we provided, a 2% bonus across the board, it would be $605,000. But they're only going to fund us based on the SOQ formula, which is going to be the same if a salary increase is, if it turns into what's called a salary increase. Now, we may receive more money for the salary increase, but there's also going to be corresponding expenditures that are going to cost more as well, because you're going to have to provide the VRS increase costs, those types of things for salary increases, where a bonus is just a one-time.
Could we use, when we gave a bonus this year, around Christmas, we can't use that towards it,
No.
validating? No.
No, and that's, there are quite a few school divisions who have done that or done something similar, or looking, those that didn't are looking to do it this spring, and, it's the same thing. But we as in the VASBA organization had some discussions about perhaps asking that the General Assembly look into adding that language so that it would be, something people could utilize.
Well, and the difference in the big picture of life and offering a bonus versus a salary increase, of course, it helps your retirement.
Yes.
And so it would be preferable if they went salary increase.
Yes. But salary increases also, continue forward. So,
Right.
that's it's something you have to be able to continue to afford to do.
Right.
So, the only other thing that possibly may come out of this General Assembly session is an increase in minimum wage. That was proposed last year and it was put on hold, but as it stands right now, effective May the 1st of this year, it's supposed to increase to $9.50 an hour. And then as of January the 1st, 2022, $11 an hour. And this could have significant impacts on us, because our substitute costs right now, our substitutes would not be making, if this changed to $11 January the 1st, we would have to up our substitute pay to $82.50 a day from $65 and $70. So that could have a significant impact on our substitute costs. In addition, right now, we don't have any contracted employees making less than $11 an hour, but our unified pay plan grade 1 starts at $11 an hour. So when minimum wage goes to $11, that's going to have a corresponding effect on all of our contracted employees, from grade 1 all the way down, that we're going to have to look at that. Cause that could be real costly over the next few years. Now, this may get delayed again, we don't know yet. However, but it's, you know, it's just something to think about, and we're gonna have to look at that as we continue to build our budget, you know, what we build in for those costs. Currently, we pay, our transportation subs are paid at $12 an hour, but our cafeteria subs are paid at $10 an hour. So we definitely would have to, you know, look at that. So at this time, all budget requests have been submitted and compiled. We are working through these requests and the required increases, as well as the needs for loss of learning recovery. We'll also be monitoring any changes in our adjustments the General Assembly may be making. This should be a short session of the General Assembly. The second session always is. However, yesterday, word was that they anticipate the adjournment will not be on time, which may delay, you know, us getting a final budget out of the General Assembly as well. So looking ahead, Dr. Weston will be presenting her budget at the February 9th school board meeting. We have a budget work session scheduled for the February 23rd. Of course, at both of these meetings, we can, you know, be making changes. We can be looking into anything that you know, would like for us to look into, making adjustments as needed. We have to submit a request for local funding to the county by the end of February. The county budget calendar, which I just got this week, includes a joint meeting with the school board on March the 9th, which is our normal meeting time, but I think we have that on our budget calendar as to be determined, but it will be, they have it as March the 9th, so you might want to mark that, and I'll send a link to you for that. I'll be glad to answer any questions at this time. I've got all the detail here for what we have thus far. In addition, any particular things you'd like for us to look at, any cost analysis you would like for us to provide, we will be glad to do that. As you can see right now, I mean, there's not a lot for us to work with, unfortunately. But hopefully things will, you know, will improve. We did get a good revenue forecast looking further, you know, for the state. The state's in a good position compared to a lot of states. So hopefully that will bode well for us in the future.
Now, Ms. Fleming, if we don't come up with if we say we're going to be short now with the figures of getting that 2% bonus or increase, what happens if you don't get it? We don't have it. I mean, do they?
Well, you can elect to not participate in the bonus, and you
Okay.
just don't receive that money. But, you know, Ms. Benjamin, we're going to do everything we can to make sure that happens. We will definitely be able to, I mean, we will make cuts wherever needed in order to make sure that
We've been very conservative
Yes.
and filling positions and things like that,
Yes.
so, and just in case, because we weren't sure what the budget, what the forecast would look like, and I think we're in a very good position to be able to
Okay.
afford our employees that bonus. We're hoping it's a raise, but,
Yeah.
you know, pay increase.
And these costs did include filling every single vacant position that we
Yes,
have
we
right
know,
now.
yeah.
So, like I said, you know, we're looking through some of that as we speak. You know, looking to see, are we filling all these, what may they need to look like? I mean, I know Dr. Weston and Dr. Gurley are working on a loss of learning recovery plan, and, you know, so all of that is going to factor into, you know, what we move forward, or what we propose to move
Okay.
forward.
So they're saying it's possibly a bonus. They're not tipping their hand as to what time of year that would come.
It's effective September the 1st.
So they get it at one-time payment or spread out in their paychecks?
No, I would imagine that you do a
one-time.
one-time payment. It would, that's what I would recommend, but 2% is not a lot of money to be spreading out over 12 payments.
No, I just thought, I
Yeah.
didn't know what they would require.
Yeah, I think the way they look at it is effective as of September the 1st. So what you have on September the 1st is based on your number of students and how they do the formula.
Right.
That would be.
Any more questions for Ms. Fleming? Okay,
All right, thank you. More to come.
thank you.
Great.
Wish I had better news.
Dr. Weston, proposed calendar.
Yes. Thank you, Ms. Benjamin. I'm here representing Dr. Gurley and his team that have worked really hard on providing us with 2 calendars to consider for the upcoming school year. And now I will tell you, they started this process very early on in the school year because, you know, as a school system, we have been thinking about, do we want to start before the Labor Day holiday, or should we continue with the traditional calendar? And so what I bring to you this evening, just for consideration, we're not ready to vote on it because we do know we need to put it out into the public, and we'll need to vote on it at a later date. And plus, I think if you've heard the governor speak last week, he did start talking about making mandatory year-round schooling. So there's a lot of things, I think, at this point. And so just want to make, just want to put that out there, that there's just going to be a lot of things that we'll need to consider. So at this point, we just wanted to bring your attention to the 2 calendars and what's different about both of them. As I said, one of them is just your normal calendar where we would start after Labor Day. Not many surprises there. It looks very similar to the calendar that we've always operated under. What I'd like you to pay attention to is the one where it's in the right-hand corner where it says pre-Labor Day start. What would be different about that would be that new teachers would report on August the 9th. So that's very early during the summer months. Let me try it again. Okay. So on the pre-Labor Day start, the new teachers would report early in August. And then on the 23rd would be the first day for students in August. And would be this August coming up. So that would be very different. And as you might know, that we can't make it any earlier than 2 weeks prior to Labor Day in order to start. We still would follow the Labor Day holiday there. Many of the other dates are very similar as far as we would take the Thanksgiving holiday. We would still have the winter break. That would not be any different. However, from a curriculum standpoint, the way that they work this out is that all SOL testing would be able to be finished, I believe, at the high school level in December. And this would afford them the opportunity to come back in January to do retesting and remediation. And then the other difference with this calendar would be, if you look at the ending date, graduation would be held on the 22nd of May in 2022, which is very early for our seniors. And then the last day of for students would be June 3rd. And so more of the summer months would be June and July versus the traditional July and August. So those are some of the differences. And as I said, we're just providing this as an informational purposes right now. Dr. Gurley and his team will be posting this out, surveying our parents and getting input for you based on our calendars, and also we'll be bringing more information to you back relative to some of the recommendations coming from the governor's office.
Now, you said the graduation would be it says on the 27th.
That's correct. I said 27th. Yes, ma'am.
Oh, okay.
I might have said a different date, but yes.
I do support the pre-Labor Day start, and mainly so that you can get your SOL test done before Christmas. It's most of the time of the year when you come back after Christmas, if there's weather-related issues, or then you have that dead time where students have been thinking about that for two weeks. So, and I hope we can eventually move to this. I do worry about the 2 weeks after and starting the new semester, just because it might be dead time for the students who don't do SOLs or who pass their SOLs. So I think if we do this, we got to think very carefully about what that looks like for a student who passes the SOLs.
Yeah.
And who is still going to school for 2 weeks and
Right.
making sure that curriculum for them is purposeful.
And I'm quite certain the curriculum is very full and that they would take full advantage of having that 2 weeks with young people. I will say that as I'm looking at both of these calendars, this is something we've talked about previously, having graduation be before the last day of school. So even the traditional calendar, they have graduation on June 10th. And the last day for other students is actually not until the 15th. And so that allows our seniors to graduate a little bit earlier than everybody else, which I think is really nice. So just, this is for your information, Ms. Benjamin and board, and we'll be bringing it back to you at a later date for approval, but we will have more information from our community as well about where their interests lie.
I like the early start. For the children, students who take the test before, a parent was kind of complaining, it looked like when the holidays come in, they forget everything they learned.
Mhm.
And even with reading books and things like that and all, so.
Yeah, yeah. Okay. Thank you so much.
Thank you. Citizen comments? Hearing none. Board member comments? Do you want to do the citizens first?
They're on the agenda.
Okay. Board member. Cheryl?
First, I'd like to congratulate Ms. Benjamin and Ms. Haney for being our new chair and vice chair, and I look forward to working with you. I also want to welcome Jamaica and Claire, and I also look forward to meeting you and working with you as well. Dr. Weston, I want to thank you, your staff, and every employee in our school system for doing everything possible to keep our students able to attend school. But while the pandemic continues, we all are facing something, one way or the other. And I was listening to you and I was making notes. You know, I had jotted down, how are we going to keep our schools open? Do we have enough qualified substitute teachers? Do we have any substitute teachers who even want to work in the pandemic? And then I was concerned about with the critical shortage, you know, exactly what are we going to do to even keep our schools safe? But you answered them all, you know, and for that I say thank you, and I am definitely in favor of the short-term virtual learning.
I appreciate the planning, going into all the different phases of, we, you know, started virtual, then we went back gradual, now we're having to back up, and that, you know, that flexibility has always been something that we've had to have. The community spread is definitely damaging and hurting the chances of school staying open. If there's anything that we can ask of our citizens is that for these next 2 or 3 weeks, you need to hunker down and stay out of crowds and do everything you can, because what's happening in the community is what's forcing us to close schools. We want to be open like everybody else is, but we can't if we can't staff, and our staff and children are being exposed to the different things that they're going to. So my biggest plea would be for the community to really be respectful of what's being asked. And of course, that will help us all, because the community and the schools. This board has strived to address the needs of our staff and our students, and that is always what we're going to do. And the fact that we have to temporarily go virtual is disappointing, but it's also necessary, and hopefully we'll be able to come right on back on time and in February and start up. And, you know, with the vaccine, maybe we'll actually get to do some real school on the end of this year. Virtual has been a great tool. I don't believe for all students it's necessarily the best way to learn. A combination of a live teacher and some virtual probably is what's going to be happening long term, but I want to get back to face-to-face as quick as we can, like most of the board does.
Mrs. Haney?
Okay, again, congratulations.
Thank you.
Ms.
Thank you for
Benjamin.
being my vice.
And I'm looking forward to trying this vice chair job. But I agree with them. I just don't, you know, we did not want to go back to virtual, but things happen, and this is what we have to do for a while. And it is a good plan. Y'all worked very well trying to get it all set up. And hopefully, like what Ms. Pittman said, by the end of January, the beginning of February, we'll all be able to get back in school and, you know, get the kids back to learning and having a almost normal semester. But I also, Mr. Barnes, you know, ran out real quick, I guess. But I'm looking forward to working with these two young ladies and hearing what they have to say today. And I know the Scholastic team won their bowl last Saturday. And I just wanted to congratulate them on that. They're doing a tremendous job. And also, I was very impressed with Brad Atkins. I guess he's the athletic director at the high school. He gives us the schedule and is letting the parents know how they can get on and watch their children play. Because I know that's important to a lot of them since they cannot be in the building or, you know, watching the students play their sports. At least they can watch them on TV. So he gave out all that information. I'm very grateful for him, you know, that he did that for us.
Dr. West, I'd like to thank you for your thorough explanation of this plan. It helps a lot of us to understand why the ins and outs. So I appreciate that, and thank you, staff, that helped you with it as well. Student representatives, I'm glad to see y'all here, excited to hear y'all's voice. We want to make the best for y'all. That's what we're here for. So that's definitely an added bonus to this board, without a doubt. I would also like to apologize, you know, if anyone was offended by any social media posts that was written by me. That was never my intention. Always like everyone to know too that I will always put the safety and well-being of the staff and students to the forefront whenever I make a decision on this board as a representative. Definitely know with this, hopefully we can return February 1st with our healthy bodies, eager minds, clear hearts, and comfortable footwear, so we can continue moving forward doing what's best for our community. So, and as always, thanks staff, students, and parents, other people.
Thank you. Thanks to each board member. Thank you for trusting me to be the chair this year. And I'm not going to add to anything anyone has said, except for I am so happy for being with the school board moving forward with student representatives. I said to someone in the community that we are going to be on the ball because we're going to know what young people want, what they need, because we're going to get it from them. And I'm so happy to have you, you two, to have been want to do this, want to hang out with us. So I'm happy about that. You know, sometimes you don't want to hang out with us, but I'm glad to have you on board with us and looking forward to learning. And I'm sure you two might can teach me some parliamentary procedure, and I'll learn from you. I'll take that from you too. But thank you so much, and Dr. Weston. Thank you and your staff and all the staff that work in the county and the system. That we really appreciate you. We can't be us without you. So we all need each other. Thank you. So now, with having said that, we're going to the student representatives. Which one? Jamaica? Mm-hmm.
Thank you all for having me here today. I really appreciate the opportunity that I'm given to give my opinion to the school board, and they can change everything within our community. Like Dr. Weston said, that I'm a virtual student, so I'm online for school the whole week. And my opinion on it is that it's hard. It's not enjoyable. It's not what I expected to be doing for my sophomore year of high school. But I make my way through it. It's very hard to stay focused and stay motivated because you don't have your teacher there physically telling you that you should do this and just motivating you to do better, but students are still able to work through it. And me personally, my internet connection at my house isn't the best, so sometimes I'm not able to connect to my classroom, which makes it harder to complete work without instruction. But I'm sure that throughout the school year and throughout the following school years, we'll be able to figure everything out and it'll be back to normal and better. Thank you.
Thank you. Well said. Thank you. Claire?
Hello. I am very honored to have this opportunity to be a part of the school board this year. I think it is amazing that y'all have allowed students to do this. I am a hybrid student, and it is very eye-opening being a hybrid student because you don't get, like, you get the school experience, but then you don't, because I have 3 kids in my first period. So I still get to interact with them, but then I don't. And when I'm at home, I find it hard, like Jamaica said, it is very hard to do school at home when you don't have internet access. And it's easier to get distracted at home. Where at school, you have your teachers, you're in your classroom, and they're telling you, you have this work that's due and you have to do it. So it's very different, but I think with hybrid, it's a lot better for the students because it's allowing them to have a sense of normalcy, because being at home can be really depressing. So being able to see your peers, but also safely, because like Dr. Wesson said, the schools are pretty much the cleanest they've ever been. So there's that. Thank you.
Thank you.
Well, I probably should have went before them, because you never want to follow like children or animals or, any of those cute, they're really cute. But, I was just sitting as I was listening to the two of them talk, and I was just thinking about this past year and what it's been like for all of us as grown people, but imagine what it's been like for young people. But as I listen to them, I'm so optimistic because, these are the young people that are going to be the grown people, right? That are going to take our places at some point and be, moving our community forward. And so I'm really optimistic that these two representatives of the kids that we have in our school system. So I'm real excited to have them on board and to be able to work with them these next few months and to come up with some ideas about what does school need to look like, because this is the chance for us to make it anything we want it to be. And we're going to really rely upon you and your classmates to do just that. And I'm really optimistic about the future of our community because it's in the hands of these young people. I would also just say that this past year's just been really different, for all of us. And I think that, as I was thinking about what our role is, working collectively together, that as we're thinking about this community, our role is first and always to look out for young people. And I heard that loud and clear when I heard you all speak about, first and foremost, every decision we make is about what's best for kids. And then as we're making decisions about what's best for kids, we have to think about what do teachers need, what do families need, and all the other people that we serve. And the second thing is that we have to be accountable to the people that, we serve, and that is our community, that are our teachers, our staff. And then the third thing is, are we affording our community with the best education possible for the money, our tax dollars, and people that are paying taxes here. And, I just want to remind people that's not always easy to do. Those are a lot of hard things to try to figure out. And it's just, there's a lot of varying ways to do that. And that's why I think that, we as a collective, we really worked well together. Ms. Benjamin always reminds us that we're better together. And that's because we all don't think the same. And I think when people come together and they think differently and they share that, and in the end, we can come up with some really good work, and we're really going to do amazing things for our young people here in this community. And I would just say to those of you that are at home and are listening that, I just would remind you, let's just all continue. We're all trying to get to the same end. And let's operate from a place of goodwill and just know, when we make mistakes, blame it on our head, not on our hearts, because our hearts are always in the right place. Thank you.
favor?
Aye.
Hearing no nays,